Hello, my name's Eliza, and this is my partner Amina, and we'll be discussing the pros and cons of complementary medicine. Amina is the negative speaker of this debate, and I will be the affirmative speaker. This will be a debate that covers three main areas: the accessibility of complementary therapies, the TGA's processes in approving alternative therapies, and holistic care and nursing. The positives and negatives of each topic will be discussed by Amina and I, supported by evidence from reputable sources. Now, to elaborate more on what alternative therapy is. As defined by Arthritis Australia, complementary therapies are any treatments or therapies that are not part of the conventional treatment, such as medicines or surgeries. Examples of complementary therapies include acupuncture, massage, aromatherapy, vitamin and mineral supplements, and herbal medicines. Estimates suggest that the number of Australians who use complementary medicines or consult with complementary therapists is on the rise. There are many safety and legal issues surrounding their use.
Our first topic is accessibility of the complementary therapies. Many people believe that complementary therapies are safer than conventional medical treatments because they are more natural. This is not always true. There are several safety and legal issues surrounding the use of complementary therapies that people need to be aware of. According to Better Health, authorised by the Department of Health, the Human Services states that complementary medicines can cause unwanted and potential dangerous side effects. For example, the herb feverfew can cause uterine contractions and possible miscarriage in pregnant women. Complementary medicines can also interact with over-the-counter and prescription drugs. For example, ginkgo and chamomile can increase the risk of bleeding in people who take anticoagulant medicines such as warfarin and anti-inflammatories such as aspirin. With complementary medicines so easily to purchase from health food stores and pharmacies, people could potentially purchase these with little to no knowledge on the risks associated with taking them. Many medical specialists need referrals, whereas services such as chiropractic medicine and osteopathy, etc. don't require them. Therefore, a qualified doctor is not assessing the patient's condition prior to the appointment.
Well, according to the Health Research Institute, complementary medicines can make a cost-effective contribution to public health in chronic disease management, preventative care, and aged care. For example, fish oils rich in omega-3 are the most effective intervention in reducing the risk of secondary myocardial infarction. For many people, having easy and quick access to herbal medicines is convenient. It means no waiting times for appointments with health professionals such as GPs. As mentioned by Amina, there is no need for referrals by GPs. I can see how this would be seen in a negative light. However, some people may not want to get an appointment with a GP just to get a referral, or even pay the fee to get a referral from a GP. Having the convenience of being able to see a chiropractor, masseuse, osteopath, naturopath, or more without a referral is easier for many people.
Our second topic is TGA processes in approving therapies. Under Australian law, every complementary medicine is assessed for the safety and quality of its ingredients, but not always its efficiency. For complementary medicines that are deemed high risk, are assessed for efficiency. Because many complementary therapies have not been thoroughly tested, it is not known if they are safe or unsafe. Complementary medicines need to be treated with the same care and respect as conventional medication. Many complementary therapies can cause side effects and may interact with other drugs. This can cause serious health problems or make other medicines less effective. The TGA does this by looking at data from clinical trials supplied by the manufacturer. Without clinical trials, we can't know for sure whether a complementary therapy actually works. The short and long-term risks of the treatment also remain unknown.
A lack of scientific evidence doesn't always mean that it doesn't work. It may mean that there is a lack of research or that the research available doesn't meet Australian standards for clinical trials. There are two categories that alternative medicines go into when they are approved by the TGA. They are listed, which means the product is considered low risk and has been assessed for safety and quality, or it comes under registered, which means the product is considered higher risk and has been assessed for safety, quality, and how well it works. The TGA assesses efficiency and safety by looking at the data that are required to be provided by the manufacturer. The TGA also ensures listed medications on the ARTG comply with relevant regulatory requirements. They conduct post-market compliance monitoring, which includes selecting some medicines, including alternative medicines, for a compliance audit. If they find that a medicine is non-compliant, they will take action according to the risk posed by the medicine to ensure that it is either brought into compliance or removed from the ARTG.
Our third and final topic is holistic care. As stated previously, there are many alternative therapies that lack evidence to support the efficiency and effectiveness. Some opt to not have the advised medical treatment and prefer to use alternative therapies. A retrospective study of 280 patients with non-metastatic breast, lung, colorectal or prostate cancer who replaced conventional therapy with alternative treatments, and 550 patients who received conventional therapy evaluated the survival outcomes over 66 months. Overall, the patients who used alternative treatments had a significantly shorter 5-year survival of 55% compared with the 78% among patients who received conventional treatment. It is important as the nurse to respect each person's decision. However, it is also our duty of care to inform them of what is currently best practice and has the most evidence to support it.
According to the Australian Nursing Federation, nursing and midwifery care is based on holistic care principles and involves physical, mental, social, cultural and spiritual care, as well as supporting the individual's family and friends as required. Holistic care can be defined as healing the whole person. The combination of holistic nursing and mainstream medicine expands a nurse's ability to offer the best treatment options for her patient. To successfully treat patients, nurses must have the necessary knowledge about diseases and an understanding of the physical and emotional influences that have an impact on illnesses and a person. Holistic nursing steps away from a detached protocol in medicine and instead encourages personalised care. To ensure patients feel empowered, options need to be provided so that they can make their own decisions regarding their health and treatment. If a patient requests to have complementary therapy such as herbal medicines, massage, myotherapy, etc., the patient's decision needs to be respected. As the nurse, we can assist them with this by pointing them in the right direction for those services. A common holistic care service is chiropractic medicine, which involves spinal manipulation performed by trained practitioners that involves using their hands to apply a controlled force to a joint of the spine. The focus on the structure and function of the spine and its relationship to the nervous system promotes general well-being. In many cases, such as lower back pain, chiropractic care can be a person's primary method of treatment, which is just one of many examples.
So, in conclusion, I believe that both Eliza and I had valid points in this debate. It is clear that there are some issues with the regulation of alternative medicines, as there is a lack of evidence to support their benefits. Although from some research and personal experience, many people have positive experiences with alternative therapy, whether it is herbal medicine, chiropractic medicine, massage, acupuncture, and more. Conclusively, the first topic discussed, which was about the accessibility of alternative medicine, highlighted many issues such as the potential risks and side effects associated with the consumption of herbal medicines. We established that it is very easy to purchase these with no professional advice. However, it was also noted that for many people, it is beneficial that they are easy to access as you can purchase them immediately without an appointment with a health professional. Secondly, we discussed the TGA's processes in approval of alternative therapies. The research showed that clinical trials are not undertaken for complementary medicine unless deemed high risk. Therefore, there is no way to prove that if they are beneficial. We also established that there are, however, laws and regulations in place to monitor the safety while on the market. The final point discussed was holistic care in nursing, which we found that is very important to care for the patient by respecting their individual needs. However, it is acknowledged that patients do need to be informed on what is best practice and most efficient in terms of treatment options. Overall, there were many pros and cons to complementary therapies. As each patient requires different approaches to health, acknowledging complementary therapies as a nurse is important. Thank you for listening to our debate on complementary therapy.